Thanks for staying with us. It's time now to answer some of your medical questions. And joining us is News Channel 5's medical specialist, Dr. David Soria. He is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks, as always, for stopping by.
Great to be here. Good to see you.
Our first question for you today, is there any way you can treat allergies caused by dogs and cats?
Well, it's a great question, and it's actually very difficult. And part of the problem is that people are in denial. They don't want to believe that their pet can actually be the cause of their allergies because, you know, there's no way they're giving Fluffy away.
Sure.
So that's one thing, and many times it's hard for them to admit that. The other is, too, I think people have a perception that they may be able to buy hypoallergenic pets. And the reality is there really is no such animal, if you will. There really isn't. If your dog licks or urinates, it can potentially cause an allergy because a lot of the allergens are in the secretions within the animal. So if you know you have a pet allergy and you feel like you have to live with him or her, then there's a couple things that you can do. It's going to take a lot of diligent work on your part. You need to clean everything because the allergen in a pet is very, very small. It can stay in the cushions, pillows, and in the carpet for months. So you got to clean, scrub at least once, if not twice a week. Keep the pet out of your bedroom. You're there a third of your life. You're being exposed all those hours. That can eliminate, or at least you bet, it can at least minimize some of your symptoms.
Okay.
And then lastly, medications.
Right. And so what do you do? You take Zyrtec or Benadryl for the rest of your life?
Well, unfortunately, there are over-the-counter things that you can take that may have to be taken for long periods of time because the allergy is not going to go away. Okay. Shots as well. So discuss it with your doctor, please.
Okay. All right. Our next question for you. If you're sore in your arm and neck, how do you know if it's arthritis or fibromyalgia?
Yeah, it can be tough to distinguish, but it's very important that you do because the two are treated so dramatically different. There's a couple of ways that you can tell. One is, first of all, the joints differ that are affected in rheumatoid arthritis versus fibromyalgia. For example, the distal joint here in your fingertips is usually not affected with rheumatoid arthritis. When you see that, you got to think maybe fibromyalgia. Also, joint swelling and deformity. You're not going to see that with fibromyalgia, whereas you will with arthritis.
Okay.
And then also there's some measures of inflammation within the blood that you can draw and test for, which will give you a reliable indication that maybe it's arthritis. Unfortunately, there is no blood test that'll tell you about fibromyalgia. Very important, though, with arthritis, the treatment is aimed at suppressing the immune system. Fibromyalgia, because there's a multitude of symptoms, you treat those symptoms and really not a cause.
Okay, all right. And our third question for you today, somewhat similar. This viewer writes, I have pain in my leg muscles and in the back of my left leg, I have ankle swelling. What causes this? How can I stop it?
Yeah, very important because even though it seems like a benign symptom, it can be serious. The list is long, so like what we just mentioned, it's important to make a diagnosis before you start shooting in the dark at treatment. So for starters, did you injure it? Sometimes the inflammation or the pain is delayed. It can happen a day earlier and you just don't correlate the two. Is there an infection? Can it be arthritis? And very importantly, can it be a deep venous thrombosis, meaning a clot in the leg that can be very serious and life-threatening? Yeah. So it's very important to make that diagnosis. Also, it could be something systemic, heart failure, liver failure, or even kidney failure. So obviously an evaluation is important to make the determination as to what it is, and then the treatment is, of course, according to what the diagnosis is. Very important. Make sure you see your doctor.
Yeah, don't play the guessing game.
No, please don't.
All right. Dr. Soria, thank you.
You're welcome.
If you have a question for Dr. Soria, you can always send it in quick and easy right at our website. Just click the health link. Scroll down on WPTV.com and you'll see a form there to send him your question there on the right-hand side of the page. Thanks so much for coming in. We'll see you next week, and we'll see you right after this short break. Stay with us.